About 5 years prior to coming to Valleywise, I had become very interested in a concept that you may have heard of called trauma-informed care. In a nutshell, what the research has shown us more and more is that from the minute a baby is in utero, from the minute that baby is born, the environment that that baby grows up and lives in affects their neurodevelopment, their brain development, and their trajectory of health and well-being, both physically and mentally, for the rest of their life. And so I became very interested in not just treating children who were sick, but also how do we promote wellness at a very young age? How do we promote healthy families and healthy environments so that we can produce children and that are the healthiest versions of themselves, both physically and mentally. They were interested in developing a pediatric department here with a new chapter of the hospital, a new chapter of the clinics, and a new chapter for the pediatric program. And I felt really called to work at a place that was not just a hospital, but an entire health system that takes care of children, but one where we could really make an impact from the moment of birth so that we start these children and these at-risk children on a journey to set them up with their families for success. Our services really span the spectrum of the lifespan of children. So we have a newborn nursery that's quite busy. We have a neonatal intensive care unit where we take care of sick babies. We have a pediatric inpatient unit. We take care of sick children here. We also, as part of the Arizona Burn Center, there is a pediatric component of that. We have 12 federally qualified health centers or clinics around the entire valley of Maricopa County. When we provide care to children at all of those locations, some through pediatrics, some through family medicine, our family medicine partners.
If a child does not have insurance, that can also be problematic for kids. And what makes Valleywise so unique is that we're able to help everybody, regardless if they can pay. I will get quite a few calls daily from different hospital systems asking if we can take these patients in. We're able to also help supply with backpacks, car seats, cribs, things that are so important. And we also do classes for them to help teach them. We have what's called cultural health navigators, and they are instrumental for making our clinics and our hospital system very successful.
There is a boy who is now about 10 who has sickle cell disease. The specialist that manages a sickle cell is typically a pediatric hematologist, but we manage his care in our clinic. Our pediatricians, people like me, try to keep up with what is the literature on sickle cell disease so that from the primary care setting, I can give him what he needs to keep him as healthy as he can be, because the specialty care he needs is not available to him. And so that's a really important role we play in this community for a lot of kids who have these special need conditions that require hospital stays and also specialty care.
Our role as the foundation that supports Valleywise Health is to raise friends and to raise funds for Valleywise to continue to do the great care that they do, and frankly to help them expand the care they can provide. So the fundraising need that Valleywise has, and us as a foundation, is very serious and very real. In my conscience, I decided 6 years ago when asked to join the board that I just need to try to help. And our board of directors is made up like that. And we're out in the community trying to meet and find other people like that just know I'm inspired to help